So I'm an interventional cardiologist. So my day usually consists of seeing patients in the clinic first. Some days I can have a whole clinic full of females. Probably more than 50% of my patients would be female. The main risk is the postmenopausal women. So most of them present with some sort of chest pain. However, a lot of them present mainly with shortness of breath. So they notice a reduction in their exercise tolerance with exercise, particularly. And some people get atypical chest pain. So they get not just chest pain, they can get arm pain, shoulder pain, neck pain, throat pain. Other symptoms which occur more commonly in females are what we call atypical symptoms. So apart from the shortness of breath or chest pain, they can just present with tiredness, fatigue, dizziness, sweats. I have had a few who've taken a while to come to see me or even see their GP, and they've had like their symptoms for 6 months or more. They've been getting chest pain, typically on exertion, but also at rest for 6 months or more, and they finally see the GP, and then the finally GP sends them to us, and then they've had like a significant narrowing in the artery that needs a stent. So I think those ones are the ones that kind of that they do stick in my mind because of how long they've taken to come and see. Whereas, men typically don't take that long, but yeah, females tend to take a lot longer. They just kind of put up with it. Yeah, so it is definitely dangerous to wait. So I think if any female is worried about any symptoms, then they should be seen sooner. Okay, it's if you've got a significant narrowing in your artery, that can just suddenly rupture and cause a heart attack, and that's the danger of kind of leaving it. Yeah, and if you think you're having a heart attack as well, then that's when you should be going to the hospital, because if you've got a blocked artery, time is muscle. So the longer it's blocked, the increased risk that you can lose heart muscle because it's blocked for so long. So I think postmenopausal women, anyone more than 45 even, should have their numbers, what we call their numbers checked. So I would check make sure they've had their blood pressure, cholesterol and sugar levels all checked and make sure they're okay. And if they're not, then just have them followed up regularly. People think, it's just the people who smoke and who have a family history or are diabetic or are overweight, they're going to be the ones who get heart disease, but it's not. There's a lot of other risk factors that we're finding that do increase your risk in the future, and that it is the number one problem in females after menopause. I think people are becoming more aware of that. Like when I first started, most people weren't aware that heart disease is the number one killer